Hi, I'm Carolina Rosadas. Thank you for the opportunity to talk about HTLV channel, increasing awareness about HTLV. Brazil has a high prevalence of HTLV. However, there is still a lack of knowledge about this virus in the country. During COVID pandemic, we realized that social media could help us to share information about public policies. So on May 2020, Dr. Tatiane Assoni and I created HTLV channel. Our main objective was to increase awareness about HTLV. However, we realized that we could use HTLV channel to communicate new research findings, to tackle stigma, to push for the implementation of public policies, and to foster collaboration between researchers and between healthcare professionals and HTLV researchers. We created videos with basic information about HTLV, and we also do live interviews. They are interactive and they are mainly with Brazilian researchers, but we also have some international guests. We also discuss patients' legal rights, capacities, stigma, public policies, and all other issues that may be interesting for those living with HTLV. We receive questions every day, and we realized that some questions, they are quite common, so we created a series of short videos to answer the most common questions, such as does antiretroviral therapy works for HTLV, or may a patient with HEM develop ACL? We also created a campaign to tackle stigma, and researchers from Brazil sent us short message of support for the patients, and we called "You Were Not Invisible to Me." On Instagram, we have more than 500 posts with basic information, such as HTLV is a sexually transmitted infection, or about HTLV-associated disease, or who should be tested for HTLV. And we also advertise new research studies and also conferences such as this one, and meetings where HTLV researchers were presenting about HTLV. We now have information in Spanish and English, and we try to identify opportunities to improve the quality of life of those living with the virus. So this is an online dance lesson for those with reduced mobility or travel advice. And we also have mindfulness and some other activities. We also organized some webinars. So in 2020, together with the Brazilian Ministry of Health, we discussed it with 16 speakers, including patients' representatives, the clinical guideline for HTLV that was published in 2021. We had 2,500 participants. Most of them were healthcare professionals. In 2021, we were very happy because the Pan American Health Organization joined us to organize the International Forum to discuss public policies for HTLV globally. So we had 20 speakers from 8 countries and about 360 participants from 43 countries. PAHO is now producing a meeting report, and we have some countries that showed interest in implementing public policies to HTLV in the region following the webinar. We also identified some issues that we should tackle to be able to promote public policies for HTLV. And we then organized the national meeting for those living with HTLV, and we are planning the HTLV workshop series. So the national meeting for those living with HTLV was co-organized by HTLV channel, HTLV, which is the patient association from Brazil, and also the Brazilian Ministry of Health. At this opportunity, we discussed how the lack of knowledge about HTLV, mainly among healthcare professionals, impact those living with the virus. And we discussed this with 5 patients from different Brazilian regions, and this discussion was quite productive. We realized that we should advertise about the centers that are providing care for those living with HLV, and we have identified that the lack of knowledge about HLV among gynecologists and obstetricians is an important issue. So we have contacted the Brazilian Association of those professionals, and we are now planning some training for those healthcare professionals. We also identified during the webinar that HLV should be integrated into existing health programs. So we now are planning with PAHO this series of workshops where we will discuss more in depth how can we in fact integrate HLV efficiently into existing programs. And everyone is more than welcome to join us. HLV also has been contributing with different Brazilian states to implement HLV into their agenda. And one of the outcomes was this recommendation to provide formula for babies born from positive mothers in Rio Grande do Norte. So we are quite happy with the achievements that we had, but we still have a lot of challenges. We don't have any financial support. This is very time consuming. We have a very diverse audience. So we have patients with HLV and their family members, but we also have researchers, policymakers, healthcare professionals, and students. So this is quite challenging. Some people think that HLV channel is there to give clinical advice, but we don't do this. And we sometimes struggle with social media. And we still have to overcome cultural and linguistic barriers if we want to increase awareness globally. So increasing awareness about HLV is actually essential to support patients, to inform healthcare professionals, to tackle the stigma, and also to promote the implementation of HLV into the health agenda. And platforms such as HLV Channel can be really helpful to be able to do this. But we need to have a strong collaboration between researchers, patients, and policymakers. And we are quite glad that we have this support. And we couldn't have achieved what we did if we don't have all these different people supporting our work. So we would like to thank those living with HLV, but also all HLV researchers from Brazil and globally, HTLV, the Brazilian Ministry of Health, and the Pan American Health Organization. And we would like to invite you all to the International Symposium about HLV in Brazil, where we are planning to be in person. Thank you very much.